The NHS Health Check programme is about improving patients' health to prevent them having heart attacks and strokes.
I'm going to go through this form with you and ask you some few questions. Is that all right? Okay. The NHS Health Check takes maximum of 20 minutes and there isn't any shortcut. Is it okay after this test today to send your results to the GP?
Yeah.
We go from the beginning to the end. We try and explain the results until they understand what we mean and the implications of the results. I mean, I ask these well-being questions so that when we get your results, we know whether it's part of the reason why you've got these symptoms.
The core of the health check is really that cardiovascular risk assessment. What we do with that, using the computer, is assess the percentage risk of a patient having a heart attack or stroke over the next 10 years.
I will enter all your blood pressure, your cholesterol, diabetes results into this tool.
And with that information, we can decide whether the patient's high or low risk and help them to think about ways to reduce their risk.
Continue with your exercise.
Yeah.
And also watch your salt intake.
Okay.
It's important that they understand the interpretation of the result and also actions to take after.
There are many opportunities. The first is the Health Improvement Hub, where patients can get advice and support to address their risk. They may need support from smoking cessation services, or in some cases they may need the input of a clinician, someone to prescribe some medication, or the confirmation of a diagnosis. So the advice has to be tailored to the individual depending on the risk factors they present and what follow-up they may need.
The hub is another section of the NHS Health Check which the government is also funding to prevent cardiovascular diseases.
This isn't about finding people with disease, this is trying to protect people from disease by showing them how they can modify the way they live their life to delay the onset of cardiac disease, so heart attacks and strokes, and keep people healthier for longer.